All right, we're going to go behind the scenes at a hospital to look at a procedure that most of us will hopefully never have to see. But it's one of the most critical routines out there for keeping everyone, patients, staff, you name it, safe from some pretty serious invisible dangers.
So let's start with a question. Picture a busy hospital. When you think of the most dangerous job, what comes to mind? Maybe a surgeon performing a really complex operation, right? Or an ER doctor in the middle of a crisis? But what if I told you one of the most dangerous jobs is something you'd probably never even think of?
Yeah, it turns out that one of the highest risk moments is all about cleaning up what gets left behind. We're talking about the super meticulous and incredibly critical job of handling biological spills.
And that brings us right to our first section. You see, in a hospital, a spill of blood or, any other body fluid, that's never just a mess. It's a potential hot zone, an invisible threat that demands an immediate and very precise response.
So, what's the big deal? Well, it all comes down to these things called blood-borne pathogens. These are tiny, infectious microorganisms that live in human blood, totally invisible to the naked eye. The protocols are specifically designed to stop what's known as the big three: HIV, hepatitis B, and hepatitis C.
And if you don't clean this up perfectly, things can go south fast in two major ways. First up, there's occupational exposure. That's when the person cleaning the spill gets infected themselves, maybe from a splash or a hidden sharp object. And then you've got the huge risk of cross-contamination, spreading those germs on shoes or equipment to other parts of the hospital, putting literally everyone at risk.
So how do you fight an invisible enemy like this? Well, it's not with a simple mop and bucket, that's for sure. They have a highly specialized toolkit for this very purpose. It's called the Biological Spill Kit. So before anyone even thinks about touching a single drop, the first line of defense goes up. The #1 absolute priority is protecting the person doing the cleanup. We're talking about personal protective equipment, or as you probably know it, PPE.
Okay, so the responder is all geared up and safe. What's next? You have to contain the hazard, stop it from spreading, and that's where highly absorbent material comes into play.
And once you've protected the person and contained the spill, there's one last crucial step. You've got to eliminate the threat. This is where the real weapon comes out, a powerful and very specific disinfectant that can kill these tough viruses.
Let's take a look at the whole shebang. You've got your heavy-duty PPE, gloves, apron, mask, goggles. Then there's the absorbent material to soak everything up. The key weapon here is a 10% sodium hypochlorite stock solution, which is basically a concentrated form of bleach. You also get special collection tools so you never have to touch anything directly, a plastic scoop and scraper. Everything that's contaminated then goes into a sealed, yellow biohazard bag. And super important, 4 steps for picking up any sharps, like broken glass. So, we've got the kit. Now for the main event, the anatomy of a cleanup. We're going to walk through the professional protocol for a large spill, which, by the way, is defined as anything more than 10 milliliters. But first, we have to talk about what not to do. Your first instinct might be to grab a spray bottle of cleaner and start wiping, right? Well, in a hospital, that is a huge no-no. Why? Because spraying it actually makes things worse. It can aerosolize the virus. Basically, it flings those tiny infectious particles right into the air for people to breathe in. Instead, the pro method is cover, soak, and lift. It's all designed to keep that danger contained right on the floor. All right, let's break down the professional protocol. Step 1, isolate the area and get that full PPE on. Step 2, cover the entire spill with your absorbent material. It is so important that you don't pour bleach directly onto the spill. Step 3, now you gently pour the disinfectant over the material, starting from the outside and working your way in. This stops it from splashing. Step 4, and this is key, you wait. Step 5, use your tools to carefully lift all that soaked material and get it straight into the biohazard bag. And finally, step 6, you mop the whole area again with fresh disinfectant, just to be sure, and then rinse it. So, about that waiting step, how long are we talking? 20 minutes. That's the magic number. And it's not just a random guess, it's the scientifically proven contact time needed for the disinfectant to completely destroy really tough viruses like HIV and hepatitis B. That 20-minute pause is what guarantees the area is safe.
So that whole process gets you thinking, what's the actual science here? What's going on in that disinfectant that makes it work so well? Let's go behind the scenes of the sterilization process itself. So this disinfectant, it doesn't just come ready to use. It has to be mixed fresh for every single cleanup.
And you have to use cold water, which is interesting because hot water actually makes the chemical decompose and become less effective. As you can see here, to get the right 1% strength from a 10% stock solution, it's a very precise 1:9 ratio. 1 part stock, 9 parts water. It's practical chemistry in action.
Okay, but real life is messy, right? What happens when things get more complicated? Let's do a quick Q&A on some common what-if scenarios. First up, what if there's broken glass mixed in with the blood?
The answer here is a hard and fast rule. You absolutely never, ever use your hands, not even with those super heavy-duty gloves on. You use the forceps from the kit to carefully pick up every single piece of glass and put it into a separate, special container that's puncture-proof. Safety first, always.
All right, next question. You know, we use alcohol-based sanitizers for everything these days. So, can't you just douse the spill in alcohol instead of bleach?
And the answer, again, is a big nope. It's all about that contact time we talked about. Alcohol just evaporates way too quickly. It can't stick around for that critical 20 minutes it takes to kill the viruses, which pretty much makes it useless for this kind of cleanup.
So let's tie all of this together. All these detailed steps, the specific chemicals, the exact timing, they're not just random rules. These are protocols designed to protect every single one of us. So what's the one big takeaway here? It all comes down to this one core idea. This is the golden rule, the fundamental mindset of infection control. Assume every single spill is infectious. You just don't know for sure what's in there, so you have to treat every incident with the absolute highest level of caution. That one simple assumption is the foundation that keeps everyone safe.
You know, this whole procedure is a perfect example of a hidden, incredibly detailed system that's working all the time to protect us, right in plain sight. It's kind of amazing when you think about it, all these unseen layers of safety that surround us. And that leaves us with one last question to chew on. What other invisible safety protocols are out there protecting you every single day?